Friday. Mind you, well, it's happy in Australia if you're an England fan. So what I thought I would do, actually, because we've had our second big report from the COVID inquiry, I've had a little read through it. I've not read any reports on it yet. I've read the actual report, or I've scanned through the main report. I've read through the abridged version, which just mostly has the recommendations and a couple of finger wagging. But I'll tell you what I thought we could do. Don't usually do this. You'll have to tell me, make sure that the sound's all right on it. Not on me, but on this. I thought we'd just listen to Baroness Hallett herself, who is the judge, or former judge technically, retired judge, who is leading the inquiry. Because she's put out a video message. Now, I am just going to warn you, she's not the greatest to camera. I don't know whether anyone's watched this yet, but I will say, we may have found someone worse than Keir Starmer at presenting a message to the public. But at the end of the day, her job is that of a judge, so, you know, we won't pick on her for that. So let's just go through this.
The resilience and preparedness of the United Kingdom, I concluded that the UK lacked resilience.
I will just say the whole point of this particular part of the inquiry, because it's split into lots of different types, right? This is the initial bit, really. This covers the initial phase, like, so early 2020, basically.
And was ill prepared for dealing with a catastrophic emergency, let alone the coronavirus pandemic that actually struck. Against that backdrop, this second report examines the response to the COVID-19 virus and how the UK government and the devolved administrations made the high-level decisions to combat it. It assesses whether those decisions were reasonable and made on the best available information. Most importantly, it considers whether the appalling loss of life from the COVID-19 virus and the devastating socio-economic consequences that ensued both from the virus and the response could have been reduced.
I will just give you a little hint here. There absolutely could have been. In fact, for those who've read some of the issue related to Wittes, I don't know. She's a good one, though. If you ever read her background, she's actually really very impressive. She's not just that she's a former judge. She's been a real trailblazer for women at the top of the judiciary. So she's actually got a very impressive background. But I will just point out. So when we talk about, like, you know, could further loss of life have been avoided? We know it could, because obviously we know that Johnson followed the science too late. He kept insisting they were following the science. We know that they weren't. I'll also just point out, by the way, that she does, I don't know whether she does it in this video, but she does in the report, slate Dominic Cummings. Dominic Cummings did not respond positively to that. He's attacked the inquiry now that, you know, he's quite happy to give evidence to it, but he's attacked the inquiry now that they've said that Dominic Cummings himself was a major source of toxic behaviour in Downing Street. In fact, quite interesting, I'll just to be very topical, right? Quite interestingly, that they attack the fact that Boris Johnson basically allowed Dominic Cummings free rein over stuff. In other words, Dominic Cummings was making the decisions and Boris Johnson was content to let him do that. That's what's come through this report. And you think to yourself, does that sound a bit familiar? Because that's, although I'm not suggesting McSweeney's on Dominic Cummings' level of insanity, nonetheless, we've got the same problem now, haven't we? We've got the problem that number 10 is effectively run by someone who's not actually the Prime Minister, just as we had then. It didn't work out well then, ain't working out well now. But anyway, little aside.
While the lockdowns of 2020 and 2021 undoubtedly saved lives, they also left lasting scars on society, the UK economy. They brought ordinary childhood to a halt, delayed the diagnosis and treatment of non-COVID health conditions.
I'll just point, sorry, I'm going to keep interrupting, but, you know, we'll probably not get through the whole thing, but I'm just going to point out. So in terms of where she talks about the impact on young people. So here's the thing about lockdowns. You know how you get people going, oh, lockdowns, and Keir Starmer wanted even bigger lockdowns. No, he didn't. He wanted earlier intervention. Labour and other parties as well, not just Labour, wanted earlier intervention. And this report says if we'd have had earlier intervention, we may not have needed lockdowns at all. But where we may have needed lockdowns, we may still have done, they'd have been much shorter. So we ended up with more lockdowns and longer lockdowns because they delayed them. The other thing I'll point out on that young people thing. So we do know that lockdowns, particularly for like growing teenagers, was socially very bad for them. I mean, it's difficult for me to appreciate it because I'm solitary, right? But for people who aren't, devastating. And we now have, I think it's something like double the number of mental health problems amongst young people compared to 10 years ago. Now, that's down to a few factors, but COVID was a massive factor in that.
Exacerbated societal inequalities and had a severe impact on people's mental health. These are all issues being explored in other modules in greater detail. In the face of a novel and deadly virus spreading rapidly around the country, politicians and administrators in the UK government and the devolved administrations were presented with unenviable choices. Whatever decision they took, there was often no right answer or good outcome.
So the point being made there is because the position we were in at the start was we were so badly prepared for it, but that is also the Tories' fault. Johnson doesn't get a pass on that either. That was the Tories' fault that we were so poorly prepared for it. I'll remind people, David Cameron was warning about the impact of a global pandemic for years when he was Prime Minister. Theresa May, the Operation Cygnus thing, so the Tories years later, after David Cameron became Prime Minister, decided to hold an exercise on how prepared are we, which is fine, that's okay, good. Found that we weren't at all prepared, but then didn't implement recommendations. But even Boris Johnson, because you could say, well, Boris Johnson, we have this whole party. But also, he personally was told in 2019 that our stocks of PPE, which were assembled by the previous Labour government, so the Conservatives had never, because it goes off, right? It decays, it deteriorates, right? So you can't keep it forever. So you need to keep, chucking it out and getting new stuff in. The Conservatives never did that. In 2019, Boris Johnson was told, we need, our stockpiles are basically knackered. We need to refresh them. And he said no. So he gets personal blame for that lack of preparedness as well. But what she's saying is, let's say Labour had won in 2019. Let's say Jeremy Corbyn was Prime Minister. He would have done much better on it, right? But what she's still saying is he still would have faced, it wouldn't have been like, oh, we've got this plan ready to go, let's put it in. They'd still be making it up on the fly. So there's an extent to which the government in 2020 was always going to make mistakes because the lack of preparation in the preceding decade hampered them. But that is still the Conservatives' fault.
Also had to make decisions in conditions of extreme pressure and initially without access to data or a full understanding of the epidemiological position. To assess what was reasonable, one must therefore put the decisions into proper context. Nonetheless, I can summarise my findings of the response as too little, too late. All four governments failed to appreciate the scale of the threat or the urgency of response it demanded in the early part of 2020, relying in part on misleading assurances that the UK was properly prepared for a pandemic. Once the scientific community and the scientific advisors for each nation had become aware that the virus was causing substantially more cases of moderate or severe respiratory illness in China than was being officially reported, and that it had spread from China, the warning signs were there.
I am going to point out, remember, we have had SARS before. So we talk about COVID, we say COVID, right? But in reality, and again, there's maybe not enough of this. In fact, one angry page just said that I'm still surprised I never caught SARS-CoV-2, which is sort of what it's officially called, because it's a SARS virus. There's different types of virus, right? Different groups of viruses. So if you said SARS, people think, oh, I remember SARS from the noughties. Yeah, we remember it then, when Labour were in charge. We actually treated that seriously. In the event, it didn't become a major issue in Britain, but we treated it as if it could have been. So this is what she's saying there. Effectively, we shouldn't have waited till disaster struck. We should have been on it. We were on it 15 years earlier, weren't we? In the early noughties, when Labour were in power, we were on it. We were treating it seriously. I remember I worked at a college. The health and safety officer at that college, which wasn't Homer Simpson, wasn't a nuclear plant, he took it incredibly seriously. Health and safety officers do tend to go over the top, but nonetheless, he took it very seriously. We had regular training on it. It never became an issue in Britain, but it was taken seriously. Here, it became a massive issue and we didn't take it seriously.
The tempo of the response should have been increased. It was not. February 2020 was a lost month. There was a serious failure by all four governments to appreciate the level of risk and the calamity that the UK faced and the need to inject urgency into the response. The obviously escalating crisis required leadership from the very top. All four governments knew that in the reasonable worst-case scenario, up to 80% of the population would be infected, with a very significant loss of life. At the same time, it also became clear that the test and trace system was inadequate for a pandemic as a result of flawed pandemic planning. Yet still they failed to take the necessary steps. This meant a national lockdown became more likely. The inquiry does not advocate for national lockdowns, far from it. Restricting people's liberty in such a draconian fashion, with all the devastating consequences, should be avoided if at all possible. But to avoid them, governments must take timely and decisive action to control a spreading virus.
See, this is the point I would really like getting out to the public. So someone's just said there, I've lost it now, about I don't think most people actually realise just how much the Tories screw us up. No, they don't. That's the problem. In fact, if we were to be hit again, in fact, we're still not taking enough action now. Now, some of the, I do blame Labour for that, because we should be taking better action right now. But I am also going to say there's an extent to which they're hamstrung by the fact the public have lost trust in what the government say about it. But the point that if you could, there's lots of things I would like the public to know. But if there's anything at all that I would like the public to know, it is this. It was possible to avoid, this is the bit she's talking about now. It was possible to avoid lockdowns. It wouldn't be guaranteed. We're not saying if they'd have got, things broadly correct, then we wouldn't have had any lockdowns, because mistakes could have been made. But there's a difference in a genuine mistake and reckless, chaotic mistakes. It was possible to not need any actual lockdowns. Now, that means national lockdowns. You may have had to restrict things in like isolated areas where you get, if you're testing properly and you're tracking the spread of the virus, which remember Boris Johnson cancelled it. The test and trace that we had, which he's just said was not adequate, but Boris Johnson cancelled it. We had one, cancelled it completely, said he said let the virus run riot. She's just said every single government knew that the virus was likely to infect 80% of people without action, with significant loss of life. That means millions of people dying, potentially. And yet Boris Johnson said, let it happen then. Let it happen. Remember, he said that on television. That's not one of these things. That's not one of the let the bodies pile high things that we sort of know he did really say, but we can't prove it. He said that on television.
The four governments of the UK did not. Had the more stringent restrictions short of a stay-at-home lockdown announced on the 16th of March 2020 been introduced earlier, when the number of COVID-19 cases was lower, the mandatory lockdown that was subsequently imposed might have been shorter. Conceivably, it might not have been necessary at all. At the very least, there would have been time to establish the effect of the restrictions on levels of incidence and whether there was a sustained reduction in social contact. As it was, the likelihood of a mandatory lockdown significantly increased as a result of the failure to act more speedily and effectively before the 16th of March. By mid-March, the UK government and devolved administrations had received clear and compelling advice. The exponential growth in transmission would likely lead to a loss of life on a scale that was unconscionable and unacceptable. No government acting in accordance with its overarching duty to preserve life could ignore such advice or tolerate the number of deaths envisaged. The governments of the UK, in taking the ultimate step to impose a mandatory lockdown, acted in the genuine and reasonable belief that it was required. They had no choice by then. But it was through their own acts and omissions that they had no choice. Also, the failure to lock down earlier may have cost lives. Had the lockdown been imposed 1 week earlier than the 23rd of March, the evidence suggests that the number of deaths in England alone in the first wave up until the 1st of July 2020 would have been reduced by 48%. That is approximately 23,000 fewer deaths.
That's a really important one for me. Again, that is something that really should be splashed over everything. She's saying, I mean, this is a judge, right? She's basing this on the expert evidence she's heard at the inquiry. What the expert evidence has said is that if Boris Johnson had a locked down even one, remember, he may not have had to lock down at all if he'd have put in non-lockdown restrictions, but some restrictions on people's activities earlier, significantly earlier, we may not have needed a lockdown at all, is what she said. But given that we got to this position where they ignored that and then had to, although she does blame all of the government, like all four governments, that's the Scottish government, the Welsh government, the Northern Ireland executive, or as well as the Westminster government, because they all had this information. She does, in the report, she presumably says in this video later on, does point out, to be fair to the others, that only the national government could impose a full lockdown, but that the other governments should still have done more. But what she's saying here is if they'd have even locked down 1 week earlier, just 1 week earlier, which was still too late, remember, they should have put in other restrictions earlier. But if at that point, when it became bleeding obvious, if it had done it 1 week earlier, 23,000 lives would have been saved. In the first wave. This is just the excess deaths caused in the first wave. And remember that he also acted too late in the second wave as well. That should be splashed everywhere. Boris Johnson killed 23,000 people because he wouldn't listen to the expert advice, because he allowed Dominic Cummings to carry out a chaotic number 10. 23,000 people is the estimate.
The decision to impose the first UK-wide lockdown was remarkable for the failure on the part of all four governments to anticipate or plan for the possible need for a mandatory lockdown. Plans for imposing stringent restrictions and for lifting restrictions should have been worked up from the outset. They were not. None of the governments in the UK had adequately prepared for the challenges and risks that a national lockdown presented. They did not scrutinise sufficiently seriously its wider societal, workforce and economic impacts, in particular the impact on the vulnerable and the disadvantaged, and the impact of school closures on children's education and their physical and mental health. Many of the same failings were repeated later in 2020. This was inexcusable. The second wave had been predicted from early in the pandemic. The UK should have been well equipped to respond. Scientific understanding of the virus had matured and data flows were much improved.
I'll also just point out in terms of the scientific expertise as well. Remember, so two officials that were always sort of, or often flanking Boris Johnson, were Sir Patrick Vallance and Sir Chris Whitty. So that's the chief scientific advisor to the government and the chief medical officer. And both of those people happened to be experts on infectious diseases. So if you think about it, a government has a chief scientific advisor, right? There's a chief, but they have various specialisms, but they're there effectively to communicate what is the scientific community wanting to tell the government, right? They're there as an interpreter, but they'll have their own specialisms themselves. Both the chief medical officer and the chief scientific officers, their expertise was infectious diseases. We're an island, so we have a lot of control over who comes in and out of. The fact that we were in the single market at the time made no difference. There were countries on the continent that were closing borders off, even part of Schengen, because in an emergency you can do that. In an emergency, of course, you can restrict travel. So we were an island. We had a much easier time, obviously Northern Ireland, you know, it's still not on the continent, but Britain is an island. We had a much easier time of controlling the flow of people. We had two people at the top of the scientific and medical advice who were actual experts on infectious diseases. We'd carried out an exercise, Operation Cygnus, some years before to test our preparedness for a global pandemic, found it fell short. It came up with recommendations. If those recommendations had been implemented, we'd be in a much better place. Now, I'll grant you, the expectation is that this global pandemic would be a flu-based pandemic, not a SARS-based pandemic, but nonetheless, we'd still be in a much better place, right? So there were several things that should have put us in a good position. We had lots of warning. Remember, this thing spread through Asia first. It spread through continental Europe before it got to us. We had lots of warning. We had lots of countries that we could... China, yes, as she said, we're not being totally honest about things, but countries in Europe were. You know, we could have learned from them as well. Tim there saying the Cheltenham Festival must go ahead, Boris Johnson. You know, it was... The thing is, he thought he was prioritising the economy. He doomed the economy. This caused, and it still is today, causing massive economic damage. It's utterly insane. Utterly insane. Fazilla there saying, I was working from home a week before Boris announced first lockdown because I watched the news. Yeah. And the thing is, I'm trying to remember back. I don't think I took it as seriously in like January, February time. And why is that? Because the government weren't treating it seriously. The government weren't. They should have been saying to people, this is like, at the very least, they should have been taking it as seriously as we did take SARS in the early noughties. And that, nothing really happened. For us, it did obviously in parts, but for us in Europe in general, SARS in the early noughties, the first one, didn't really hit us. This did, but even at the time, even if you thought we might get away with it, you should still have said, but the consequences of not getting away with it are going to be devastating to the economy as well as life. Absolutely insane that the way. And I remember when I first started doing videos on it, when it became clear at that point that shit hit the fan, I had people saying, you know, oh, this isn't political, Phil. You're just having a pop at the government. It's like, no. And I said to them, it shouldn't have been political. It should have been a case of the government saying, this is a serious situation. Scientific advice is what you got from me. Right, we'll do that, right? The job of the politicians should have been to communicate to the public what was going to happen. The job of the politicians, the job of the governments at that time should have been to implement the expert advice. And it wasn't. In fact, Boris Johnson and Dominic Cummings, when you read the report, what it looks like to me is they were trying to work out how they could avoid following the scientific advice. They were actually going, how much of this scientific advice do we have to follow to just get away with it? That was what it was like doing. What's the bare minimum we have to do? And of course, so it's like a lazy student. I've had it before with coursework. What's the bare minimum we have to do? And the problem with a lazy student is that what they think is the bare minimum is never the bare minimum. It's always bollocks, right? So you have to throw it back at them. And utterly unconscionable. So, no, it shouldn't have been political. It should have been government going, right, this is what we need to do, and communicate it to the public and doing what the scientific advisors were telling them to. But instead, they tried to do the bare minimum, then later on tried to suggest that the scientists didn't know what to do themselves or they were inconsistent. It's like, no, they were still learning some things, but there were certain things we knew. For example, the fact that it was an aerosol, the fact that it was transmitted through the air, right? All this hand washing bollocks. It's transmitted through the air, right? We knew that very early. I remember a BBC News article on the website very early on, early in the first wave, in fact, explaining this. And yet the government kept talking about hand washing and stuff, which is like, fine, yeah, wash your hands. But nonetheless, the transmission was via the air, which means if you're indoors without much ventilation, like, you don't even have to be in the same room as someone who's infected, because as I'm talking now, droplets coming from my mouth are suspended in the air, and they'll be there for hours, raining down on anyone else who comes into this room. It's a bit disgusting, really, but nonetheless, that's the fact. And this BBC article, to be fair, was explaining that. That's BBC were actually trying to explain this, but you know, the government didn't back it up. It didn't get through to the public. The problem is she's not saying like Phil. Well, I mean, you know, at the end of the day, I don't have to be.
Testing and surveillance capacity have been strengthened. Each government had ample warning that the prevalence of the virus was increasing and would continue to do so into the winter months. Yet again, there was a failure to take timely and effective action.
So this is the second wave now. She's basically saying the second wave was predicted before the first wave was even over. And we know that because virologists know that and epidemiologists know that these things do come in waves. So as soon as we were being hit, it was always described as the first wave. It was always described as the first wave because the experts knew there would be a second and a third and a fourth. And the idea is supposed to be that each subsequent wave should be much smaller. And the government, even when they knew that the end of the first wave wasn't the end of the problem, that there would be a second one, what did they do? Eat out to help out. Ridiculous idea.
Such measures as were introduced in England were unlikely to be effective. For example, the rule of six and the tier system. Yet measures like a short circuit breaker lockdown that may have been effective were not imposed in late September or early October 2020. The evidence suggests that had one been imposed in September 2020, the second lockdown on the 5th of November could have been reduced in length and severity and might conceivably have been avoided altogether. Similarly,
and that's another thing for all those people who keep going, oh, Starmer went to the lockdown, Starmer went to the lockdown. No, Starmer was the one calling for the circuit breaker because the experts were. Like, what we'd learned from the first wave is the government had not listened to the expert advice. They kept saying they follow the science. We knew after that first wave that was not true. Remember, we also had the public SAGE group. You had that special SAGE group that was set up by independent scientists to try and communicate things to the public, because they were basically saying to the public, the government are lying about what their own scientific advisors are saying, so we're going to try and communicate things. And, you know, so what was going on there is they, again, could have avoided the lockdown, at least made it much shorter. Starmer was calling for a circuit breaker because the experts were, and they didn't get one. They ended up with a circuit breaker was, this is where we've got flare-ups, let's put restrictions in those places so we avoid having to do it across the whole country. And they didn't do it. They refused to do it. Yeah, Dave saying nurses died. So in terms of the ones that were really badly hit, all frontline health and social care workers, people in care homes as well as the residents in care homes, because they were much more vulnerable, all of those were really badly hit in terms of incidences of long COVID and deaths to this day. Second would be teachers, because of, classrooms were generally poorly ventilated, particularly in that second wave, because it was like autumn and winter. So it was bloody cold if you had the windows open, even though I had mine open anyway, because I was teaching at the time, part-time. But nonetheless, you would be in there with like no ventilation, and they weren't putting in air filters in. Like, they should have had air purifiers in. They're not expensive. They're not expensive. In fact, I'd have taken my own in if I'd have sort of known at the time. Then Ivan there saying, yeah, they partied while housebound people like me were not allowed to have just one person visitors home. That is exactly now why, if we were hit again, we would do very badly, even with a decent government, because the public don't trust the government. If the government tries... Now, hopefully what would happen is the government would say, look, this is what we know from the last time. We need to just put in some restrictions and then we can avoid a full lockdown. But if people didn't comply with it because they don't trust them, or if people... and not enough happened, then you had to order a full lockdown, again, compliance would be very low. So that's the problem now. The problem is that Boris Johnson, to save his own sorry hide, tried to suggest that people interpreted the guidance too strictly. No, the guidance, when it eventually came, was necessary. It's the party in Downing Street that was not. And they knew it wasn't, because they were caught sneaking wine and cheese into Downing Street in suitcases. They took suitcases to the local shops to hide it. You don't go... and I know when you go shopping these days, you take your own bag, right? To reduce single-use plastic. That's what we do. So you take your own bag. You don't take a suitcase. No, what I've seen people have all sorts of weird and wonderful types of bags, sometimes like sports bags when they've gone shopping. Why not? Whatever sort of bag you've got. I've never seen anyone go to Tesco and put their groceries in a suitcase, right? But that's what they did. They did it because they wanted to conceal that they were taking party food into Downing Street. Tories were telling me the money comes first. Yeah, but they destroyed our economy. Because the problem is, once you have to lock down, that's your economy locking down as well. Whereas if we could have just put in some restrictions, where it was, if we were tracking it properly, knew where the flare-ups were, restricted those little areas, isolating it. Even people in the 17th century knew that when we had plague for like 100 years. Even they knew that when you had a flare-up, you isolated that village. Even they got that. And that bloody plague killed like half of Europe or something stupid, because, we didn't even have germ theory back then. But, we like, it's like 17th century Britain dealt with plague better than 21st century Britain. It's utterly ridiculous. The entire thing was, how can we get good headlines in the Telegraph tomorrow? Oh, no, they had that sewn down. That was easy because they just paid them. There were a load of newspapers. Obviously, with lockdown, people can't go out to the shops even as easily. You could like have one trip or something. So newspapers really struggled. So what the government did to tide them over is they took out, at public expense, of course, large, full-sized advertisements in the newspapers to give them revenue, which, of course, meant that the newspapers then owed the government a favour, didn't they? MC saying, I contracted early because of working with young uns, felt like a ton of bricks. Well, that was the other thing, because they said that, I'll take this out because actually we've run out of time to listen to more of it, I'm sorry. But they were saying things like with young people, oh, it's fine for young people are fine, as if like young people were immune to it. No, they weren't. And they could pass it on. And you could pass it on to someone. Like you might, like Warren Pagan was saying, he never got COVID. Well, but people around him did. Well, you don't know that. You might have had COVID. You may be the one that passed it to them, because we had this concept of the super spreaders. These are people who didn't suffer from symptoms, but you're still infected and infected. Now, admittedly, if you're not displaying symptoms, you're less likely to infect others because you're not coughing and spluttering and all the rest of it, right? But you can still infect others. Like as you are talking, I know it's a bit disgusting to think about it, but as you are talking, you are spraying droplets out. Just they're microscopic, you can't see them. But they're coming out every time you open your mouth and talk. You're expelling air. Where are you expelling air from? Your lungs. It's passing through a very moist environment. You are expelling lots of micro droplets every time you speak. Every time you speak, your air is being driven, through your trachea, through your mouth, and out to the atmosphere. So you're spraying droplets. I'm spraying droplets right now all the time. They're being suspended in the air. So you can be someone whose your immune system was strong enough to fight the virus, but whilst you were fighting it, you were infectious. And whilst you talk, so you could have had people, I never got COVID. It's like, you may have got it several times, but you just never succumbed. I got it once and I did not enjoy it. And I took, a lot of efforts to try and avoid. I still now, if I'm going into unventilated areas, if I can, sometimes you can't always, where I've got face masks in my car and I always have one, they're in sealed packets, in my coat pocket. So if I go into when I go to the supermarkets, for example, I've got a face mask on. I don't have them all the time when I'm indoors, but because sometimes you're eating or drinking or something like that or whatever. But where it makes sense, especially going to shops, I do wear a face mask now because we haven't got rid of it yet. It's not killing as many people, but I will still point out it is still killing people. And I know people say things like, oh, but flu kills people as well. It's like, yeah, we could try and stop that as well, shall we? Should we not just say, because people die, a thing that can kill you, we don't have to worry about it? Should we just say, should we reduce the number of people who die from it? They didn't care that people died, they just cared about their money. But their money, yes, their money. They made lots of money out of it via the VIP lane. But of course, the government didn't. They said that they were trying to focus on the economy, but they damaged the economy. We actually could have come out of this really well. We had a really good chance. We're an island. We were pretty much the last place to be hit. Not the absolute last, but, in Europe, certainly, pretty much the last place to be hit. We had experts, infectious diseases experts on hand for the government. If we'd have had a functioning government, even a Conservative government that wanted to be tight, if it just wasn't even Liz Truss may have done better than Boris Johnson, is what I'm saying. What I'm saying is, I don't think whoever was Prime Minister would have shone, because I think the fact that we hadn't prepared for the pandemic would have meant cock-ups. The fact that Operation Cygnus, so let's say Labour had won 2019. I think they still would have come under a fire for the pandemic response. I don't think there was any way of avoiding that because the preparation wasn't there. The last Labour government did prepare. They had a pandemic response plan, which the Conservatives should have built on, and they didn't. They actually just lost it, literally lost it. But if we'd have had anyone other than Boris Johnson, it probably would have been much, much better. But preferably not another Tory, though. But it is what it is. Anyway, there's lots more to pick over this. I'll try and pick out some key bits and maybe do a video on it tomorrow as well. But thanks for coming, everyone. I've got to go ready for my stream with Graham in 20 minutes, I think. Have a great rest of the day. And until next time, I'll see you later.